13 early signs of diabetes you should never ignore. Most people believe diabetes announces itself with obvious warning signs. In reality, for millions of people, it creeps in quietly, hiding behind symptoms so ordinary that they get blamed on stress, aging, or simply being busy. This video is for educational purposes only and is not intended to diagnose any medical condition or replace advice from a qualified healthcare professional. If anything you hear today sounds familiar, please consider speaking with a doctor. Here is something worth sitting with for a moment. According to global health researchers, roughly 1 in 10 adults on Earth is currently living with diabetes, and a significant portion of them do not yet know it. Some studies suggest that a person can carry undiagnosed type 2 diabetes for several years before symptoms become noticeable enough to prompt a doctor's visit. During that time, the condition can quietly affect the eyes, the nerves, the kidneys, and the heart. That is the part most people never hear about, and we are going to walk through it together. Part of the reason this happens is that the body is remarkably good at compensating. In the early stages of insulin resistance, the pancreas often produces extra insulin to keep blood sugar levels within a workable range. This means a person can feel largely normal for a long stretch of time, while, underneath the surface, their metabolism is already working harder than it should have to. By the time symptoms become impossible to ignore, changes may have already been building quietly for a while. That is part of why the signs on this list matter so much. They are the body's early attempts to get attention, long before a more obvious crisis occurs. Over the next several minutes, we will go through 13 signs the body may show when blood sugar levels start to drift outside a healthy range. Some of these will sound familiar right away. Others are so subtle that even attentive people miss them for months, sometimes attributing them to work stress, aging, or simply having an off week. And toward the end, we will talk about one particular sign that doctors consider especially important to recognize early, because it can point to a level of urgency that the earlier signs usually do not. So stay with us, because that one might be the most useful thing you take away from this video. It is also worth mentioning that these signs can apply differently depending on the type of diabetes involved. Type 1 diabetes, which often develops in childhood or young adulthood, tends to produce symptoms more quickly and more intensely, sometimes over the course of just days or weeks. Type 2 diabetes, which is far more common and tends to develop later in life, usually progresses far more gradually, which is exactly why it so often goes unnoticed. Most of what we will cover today applies broadly to both, though we will point out where the pacing tends to differ. Let's start with the one almost everyone has heard of, but few people take seriously enough. Number 1, increased thirst that will not go away. Doctors call this polydipsia, which simply means an unusually persistent feeling of thirst. Here is why it happens. When there is too much sugar circulating in the bloodstream, the kidneys work overtime trying to filter and absorb the excess. When they cannot keep up, that sugar spills into the urine and pulls water along with it. The result is more frequent urination, which in turn dehydrates the body, which in turn triggers an intense, almost relentless thirst. Margaret, a 67-year-old retired schoolteacher, described it this way to her doctor. She said she had started carrying a water bottle everywhere, refilling it constantly, and still felt parched by the middle of the afternoon. She assumed it was simply the summer heat. It took a routine blood test, unrelated to her thirst, to reveal that her blood sugar levels were significantly elevated. Her case is a common one. Thirst that seems disconnected from activity level, weather, or diet is often dismissed, when it may actually be one of the body's earliest signals that something deserves attention. What makes this sign particularly deceptive is how easily it blends into daily habits. Many people simply respond by drinking more, which does relieve the discomfort temporarily, without ever asking why the thirst appeared in the first place. A useful way to think about it is this. Ordinary thirst usually responds to a glass or two of water and then fades. The kind of thirst associated with elevated blood sugar tends to return again within a short while, almost as if the body cannot quite catch up no matter how much fluid is consumed. Number 2, frequent urination, especially overnight. Closely tied to the first sign, frequent urination, particularly when it disrupts sleep, may be an important clue. Waking up 2, 3, or more times a night to use the bathroom is sometimes brushed off as simply a normal part of getting older. And while that can be true for some people, it can also be the direct result of the kidneys trying to eliminate excess glucose from the blood. What makes this sign tricky is how gradually it tends to develop. A person might go from waking once a night to twice, then to 3 times, over the course of many months, adjusting their routine without ever questioning why. Some people even begin restricting how much water they drink in the evening, assuming that is the responsible fix, without realizing that the underlying cause has nothing to do with how much they had to drink before bed. If nighttime bathroom trips have become a new and consistent pattern, it may be worth mentioning to a healthcare provider, especially if it is paired with the thirst we just talked about, since the two signs are closely connected and often appear together. Number 3, fatigue that sleep does not fix. There is ordinary tiredness, the kind that comes after a long day and disappears with a good night's rest. Then there is a different kind of exhaustion, one that lingers no matter how much sleep a person gets. This second kind may be associated with how the body processes glucose for energy. Under normal conditions, insulin helps escort sugar from the bloodstream into the body's cells, where it gets converted into usable energy. When insulin is not working efficiently, or when the body is not producing enough of it, that sugar stays trapped in the blood instead of reaching the cells that need it. The result can feel like driving a car with plenty of fuel in the tank, but a fuel line that is partially blocked. The energy is there, it just cannot get to where it is needed. People often describe this fatigue as a heavy, foggy tiredness that coffee does not seem to touch, and that no amount of extra sleep seems to resolve. This kind of fatigue also tends to worsen after meals, particularly meals high in refined carbohydrates or sugar, which can cause blood sugar to spike sharply and then fall again. Many people notice a familiar slump in the early afternoon, sometimes called the post-lunch crash, and while everyone experiences some degree of this from time to time, a crash that feels disproportionately severe, or that happens after nearly every meal, may be worth paying closer attention to. Number 4, blurred vision that comes and goes. Sudden changes in eyesight, especially blurriness that seems to fluctuate throughout the day, may be connected to shifting blood sugar levels. High glucose can cause the lens inside the eye to swell slightly, changing its shape and temporarily affecting how it focuses light. This is different from the gradual vision decline that comes with normal aging, because it can appear and disappear relatively quickly as blood sugar rises and falls. Robert, a 54-year-old contractor, noticed that his vision seemed sharp in the morning, but grew hazy by late afternoon, especially after meals. He initially assumed he needed new glasses. His optometrist, noticing the unusual pattern, suggested he see his physician before updating his prescription. That conversation turned out to be an important one. While an eye doctor cannot diagnose diabetes directly, unexplained and fluctuating vision changes are sometimes the reason people end up getting blood sugar tested in the first place. Number 5, cuts, scrapes, and bruises that heal slowly. The body's ability to repair itself depends heavily on healthy circulation and a properly functioning immune response. Elevated blood sugar over time may be associated with damage to small blood vessels and nerves, which can slow down the healing process. A minor cut that would normally close up within a few days might instead take 1 or 2 weeks, and small bruises may seem to linger far longer than expected. This sign is easy to overlook because healing speed is not something most people track closely. A scraped knuckle or a small kitchen burn is rarely cause for concern on its own. But when slow healing becomes a repeated pattern, especially alongside other signs on this list, it can be a meaningful piece of the larger picture. Feet in particular deserve extra attention, since reduced sensation combined with slower healing can allow small wounds to go unnoticed for longer than they should, which is part of why healthcare providers often recommend that people with diabetes check their feet regularly. Number 6. Tingling, numbness, or a burning sensation in the hands and feet. This particular sign relates to something called peripheral neuropathy, which refers to nerve damage that most commonly affects the feet and hands. Over time, elevated blood sugar may be associated with gradual damage to the small nerves responsible for sensation. People sometimes describe the feeling as pins and needles, a mild burning sensation, or a strange numbness that makes their feet feel slightly disconnected from the rest of their body. Dorothy, a 72-year-old grandmother, first noticed the sensation while gardening, describing it as feeling like her feet had fallen asleep even though she had been standing the whole time. She mentioned it to her daughter, who encouraged her to bring it up at her next checkup rather than waiting. That single conversation led to further testing. Nerve-related symptoms like these tend to develop slowly and can be mistaken for poor circulation, tight shoes, or simply getting older, which is exactly why they are so frequently missed. One detail worth knowing is that this sign often follows a particular pattern, sometimes described by doctors as a stocking and glove distribution, meaning it tends to begin at the furthest points of the body, the toes and fingertips, before gradually working its way inward if left unaddressed. Because the sensation often starts so mildly, many people adjust without realizing it, walking a little more carefully or avoiding certain textures underfoot, long before they consciously identify what is actually happening. Number 7. Unexplained weight loss. This sign often catches people off guard, because losing weight without trying is sometimes seen as a welcome surprise rather than a warning sign. When the body cannot use glucose properly for energy, it may begin breaking down muscle and fat stores instead, searching for an alternative fuel source. This can lead to noticeable weight loss even when a person's eating habits and appetite have not changed. It is worth being clear here that unexplained weight loss can have many possible causes, and diabetes is only one of them. Still, when weight drops steadily without changes in diet or activity level, it is generally considered a sign worth discussing with a healthcare provider, simply to rule out anything that may need attention. Number 8. Frequent infections. Elevated blood sugar can create an environment where certain bacteria and fungi thrive more easily, while at the same time may be associated with a weakened immune response. This combination can lead to more frequent infections, particularly urinary tract infections, skin infections, and yeast infections. Gum infections and slow-healing mouth sores are also sometimes reported. What tends to stand out here is not a single infection, but a pattern. One urinary tract infection in a year is common and usually unremarkable. 3 or 4 within the same year, especially alongside fatigue or increased thirst, may be a signal that the body's blood sugar regulation deserves a closer look. Recurring yeast infections, in particular, are sometimes one of the first clues that leads a doctor to check blood sugar levels, since elevated glucose can appear in places like sweat and other bodily fluids, creating conditions where certain organisms multiply more easily than they normally would. Number 9. Dark, velvety patches of skin. This sign has a specific medical name, acanthosis nigricans, and it tends to appear as darkened, slightly thickened patches of skin, most commonly around the neck, armpits, or groin area. The exact cause is thought to be related to elevated insulin levels in the blood, which may be associated with excess growth signaling in skin cells. These patches are sometimes mistaken for dirt that will not wash off or for a harmless discoloration related to sun exposure. Because they usually develop gradually and painlessly, they often go unnoticed until a family member or a doctor points them out. Dermatologists sometimes describe this as one of the more visually recognizable early clues, precisely because it appears on the skin rather than being an internal sensation a person has to consciously notice. This sign also tends to show up somewhat earlier in people who carry excess weight around the midsection, and it is sometimes one of the very first physical indicators, appearing even before blood tests reveal any significant changes. For that reason, some physicians consider it a useful visual cue worth checking during a routine physical exam, even in people who otherwise feel completely well. Number 10. Constant hunger even after eating. Feeling hungry shortly after a full meal might seem like nothing more than a big appetite. But when it becomes a persistent pattern, it may be tied to how effectively the body's cells are receiving glucose. If insulin is not doing its job of shuttling sugar into the cells, those cells essentially send out a distress signal indicating they are not getting the fuel they need, even though there may be plenty of sugar present in the bloodstream itself. This creates a frustrating cycle. The body eats to gain energy, but if the sugar cannot reach the cells that require it, hunger returns quickly, sometimes within an hour or two of a substantial meal. People experiencing this often describe feeling like their appetite has a mind of its own, disconnected from how much food they actually consumed. James, a 49-year-old warehouse supervisor, mentioned to his wife that he had started packing extra snacks for work because his usual lunch simply was not holding him over anymore. He had not changed his portion sizes and was not more physically active than usual, yet the hunger kept returning earlier and earlier each day. It was his wife, noticing the pattern over several weeks, who suggested he get a checkup, which is often how these subtle signs come to light. They are easier for the people around us to notice than they are for us to notice in ourselves. Number 11. Dry, itchy skin. Dehydration caused by frequent urination, combined with reduced circulation in small blood vessels, may contribute to skin that feels unusually dry or itchy. This is sometimes most noticeable on the lower legs, feet, and hands, areas that rely on healthy circulation to stay properly moisturized from within. This particular sign is one of the easiest to dismiss, since dry skin has countless everyday causes, from harsh soap to seasonal weather changes to simply not drinking enough water. On its own, it rarely raises concern. But paired with several of the other signs discussed in this video, it can become part of a larger and more telling pattern. Number 12. Irritability and unexplained mood changes. The brain relies on a steady, stable supply of glucose to function properly, and fluctuating blood sugar levels may be associated with noticeable shifts in mood, concentration, and patience. Some people describe feeling unusually irritable, foggy, or emotionally on edge, particularly a few hours after eating, when blood sugar levels may spike and then drop sharply. This sign is often the hardest for people to connect to a physical cause, because mood changes are so easily attributed to stress, poor sleep, or the normal ups and downs of daily life. Family members sometimes notice this pattern before the individual does, commenting that a loved one seems more short-tempered or withdrawn than usual, without anyone immediately considering that blood sugar could be a contributing factor. And now, the sign we mentioned earlier, the one many people do not realize is more urgent than the others. Number 13. Sweet or fruity-smelling breath, along with rapid breathing or confusion. This sign is different from everything else on this list, because unlike the others, it can indicate a situation that may require prompt medical attention. When the body is severely lacking insulin, it may begin breaking down fat at a rapid rate for energy, producing byproducts called ketones. In high concentrations, ketones can cause a distinctive fruity or sweet smell on the breath, sometimes compared to nail polish remover. This can be accompanied by rapid or labored breathing, confusion, nausea, abdominal discomfort, or unusual drowsiness. Medical professionals refer to this more serious state as diabetic ketoacidosis. It tends to develop more quickly than the other signs discussed today, sometimes over the course of hours rather than months, and it is generally considered a situation that should not be waited out at home. If someone is experiencing fruity-smelling breath along with confusion or rapid breathing, seeking emergency medical care is strongly advised. This is precisely why we wanted to save this sign for later in the video. It carries a different level of urgency than the others, and it deserves to be recognized for what it is. It is worth noting that this particular sign, while the most serious on this list, is also relatively uncommon compared to the others. It tends to appear in situations where blood sugar has been left unmanaged for an extended period, or in people who are not yet aware they have diabetes at all. That is precisely why awareness of the earlier, quieter signs matters so much. Recognizing thirst, fatigue, or slow healing early on gives people the chance to get proper testing and guidance long before a situation like this one has any chance to develop. So where does this leave us? 13 signs, some subtle, some more pronounced, all worth knowing: increased thirst, frequent nighttime urination, persistent fatigue, blurred vision, slow healing, tingling in the hands and feet, unexplained weight loss, frequent infections, darkened patches of skin, constant hunger, dry, itchy skin, mood changes, and that final, more urgent sign, fruity-smelling breath paired with confusion or rapid breathing. It is worth remembering that one sign in isolation rarely tells the whole story. Bodies are complicated, and many of these symptoms have entirely harmless explanations. But when several of them show up together or persist over time, that pattern is generally considered worth discussing with a healthcare professional. A simple blood test, one that most doctors can order during a routine visit, is often all it takes to get clarity. There is no need to wait until symptoms become severe or disruptive before asking the question. And that one statistic from earlier is worth repeating because it says so much on its own. Roughly 1 in 10 adults worldwide is currently living with diabetes, and a meaningful share of them do not yet know it. Behind that number are people like Margaret, Robert, Dorothy, and James, ordinary people going about ordinary days, whose bodies were quietly trying to tell them something long before anyone put the pieces together. If any of these signs sounded familiar while watching, we would genuinely like to hear about it. Which one surprised you the most? Let us know in the comments below, because your experience might be exactly what helps someone else recognize the same pattern in themselves or in someone they love. If you found this video helpful, please consider sharing it with someone who might need to hear it. And if you would like more clear, careful explanations of health topics like this one, subscribing helps us keep making them. Thank you for watching, and take care of yourself.